So there's good news. We have 6 vaccines approved for full use worldwide. A year ago, I would have been one of those people, I was one of those people saying the quickest we've ever developed a vaccine is 4 years. There's no way we'll have one by the end of 2020. And thank goodness I was wrong. A lot of money was put towards developing vaccines, and no safety steps were skipped, but some of them were done in tandem rather than sequentially. We have another 6 vaccines that are in early or limited use, and then we have a lot of vaccines coming up through the testing, the phase 1, 2, and 3 testing. 21 are in the final testing stages, and then we have another 78 that are in animal trials. In the United States, we have 3 extremely efficacious vaccines that are under an emergency use authorization. The word efficacious is used to describe results that are found in clinical trials. Effectiveness is the word that's used when you roll it out in the real world. And we don't know about that yet, but it's looking really, really good. There are 2 vaccines that use messenger RNA, one that uses a vector, an adenovirus vector. And the goal of vaccination is to get us to herd immunity. That is where there are enough people are immune so that the virus can't spread very easily because everybody or most everybody's immune. We would have been happy a year ago if we had a vaccine that was 50% efficacious, and yet we've got these 3 that are extremely efficacious. Sometimes people are concerned that the Johnson & Johnson vaccine doesn't work as well as the other 2. It's really, you can't really make that comparison. It's comparing apples and oranges because they were tested with different outcomes. Sometimes it's, does it prevent mild disease or severe disease or hospitalizations? They were tested at different times. When the first 2 vaccines, Moderna and Pfizer, were tested, there was not as many cases around. So you determine how efficacious these vaccines are by comparing the vaccinated, how many people had a severe outcome, for example, versus the placebo group. But if there's not as much virus around, then the placebo group is less likely to get infected just because they don't come in contact with the virus. So whereas the Johnson & Johnson was tested when we had much higher numbers of cases, and also the Johnson & Johnson was tested when these variants were around, and I'll talk about that in a minute. But again, people ask me which vaccine should you get, and my answer is whichever one you can. They're all 3 really good. The advantage of Johnson & Johnson is one and done. Next slide, please. So SARS-CoV-2 is a pandemic. That means it's around the world. So controlling the virus just in the United States is not enough because we're a world economy. People travel. And even if we control it in the United States, it can always be reintroduced by people from other countries where it's not under control. And this just shows you the number of vaccine doses per 100 people. Israel has done a fantastic job, as has the UAE. United States is up there, and then some other countries. But we really need to think globally about controlling the virus. Next slide. But of course, it's not all good news. One of the things we don't know about vaccination, we know that it protects the vaccinated person from getting sick, and particularly from severe disease, which is what we want. You might still have some mild symptoms, so what? What you don't want is to have to be hospitalized and die. But what we don't know is if you can still get infected, either not have symptoms or mild symptoms, and transmit the virus to somebody else who's not vaccinated. We're getting those data right now, but the preliminary evidence looks like, no, you can't. And in Israel, when they had vaccinated 90% of the 60 and older population, they found that the cases plummeted, which is some evidence that those vaccinated persons were not transmitting the virus. So, stay tuned, but it's looking pretty good there. We don't know how long immunity lasts. Again, because the phase 3 trials, that's the last trial you do in tens of thousands of people before you go to the FDA and ask for EUA, emergency use authorization, were done last summer and forward. But, people haven't been vaccinated long enough to see how long immunity lasts. We know it lasts for at least 6 months. Does it last for a year? Does it last for 2 or 3 or whatever years? We just don't know. It may be that the COVID vaccine ends up being like the flu vaccine, where you just have to get a booster every year. We just, again, don't know. Then there's the variants. There's three. The virus, the SARS-CoV-2, is a virus that can change its genetic material pretty easily. The fact that we've seen variants is not unexpected, although we have been a little surprised how much the virus has changed in these variants. And there are three that we are particularly concerned about right now. One that originated in England, one that originated in South Africa, and one in Brazil. The one from the UK appears to be more infectious. At first, we thought it didn't cause more severe disease. Now that's in question. It may be that it does. We're particularly concerned about the one from Brazil, that does seem to cause more severe disease. The good news is the vaccines we have, those three that are under an emergency use authorization in the United States, protect at least somewhat against these variants. And the messenger RNA vaccine, the Moderna and Pfizer vaccines, can be tweaked relatively easily to protect against these variants should the original vaccine not work. We're going to see more variants. That's every time that virus makes more of itself, there's a possibility that a change occurs. And that's why we're really pushing vaccination, not just to protect people, but to stop or limit the possibility of more variants arising. We've seen politicalization of immunization, which is unfortunate. We don't do that with other vaccines. It is unfortunate that has happened with this vaccine. We have a lot of myths around the vaccine. There is vaccine hesitancy, although that has been decreasing as getting the vaccine becomes more the norm. We have vaccine barriers, particularly in communities of color, which is unfortunate because those are the communities, if you remember that table, that are more likely to have hospitalization, to get infected, be hospitalized, and die from the virus. And then vaccine nationalism, where the richer countries, like the United States, are sitting on doses of vaccine that they're not going to need. And if you remember, this is a global pandemic, and it behooves us to make sure the whole world is vaccinated, not just us. Next slide, please. So the big question, there's my crystal ball, is when will we get back to normal? Well, as of a couple days ago, about 1 in 5 in the United States have received 1 dose of vaccine. This is talking because the J&J, which is only 1 dose, had just been authorized. This is really talking about mRNA, where you need 2 doses. And about 10% are fully vaccinated. The president has said that everyone eligible for vaccination should be able to get it by May 1st. there should be enough vaccine for everybody to get it by May 1st. I think it's actually May 31st is the what we're aiming for to get everybody vaccinated. So I talked about herd immunity, and the question is, what percent of the population needs to be immune for herd immunity to happen? We're not sure. It's a new virus, but we think it's probably 85%. That means we have to vaccinate almost everybody. But right now, we can't vaccinate 20% of the population, and that is children under age 16. Now, those trials are starting. Moderna just announced that they're starting a trial in 6-month-olds to 16-year-olds. So we will have, presumably, we will have a vaccine for children maybe by the end of the year, but we don't have it right now. Bottom line is we're going to be practicing those non-pharmaceutical interventions, masking, social distancing, washing your hands, which really you should be doing whether or not coronavirus is out there or not. There's a lot of other diseases spread that way. So we're going to be doing that for a while. We are hopeful that schools will physically reopen in September. And CDC just, I think it was last week, released guidelines about what fully vaccinated persons can safely do. And the hope is that for those who are vaccine hesitant, who say, I'm not saying I won't get vaccinated, I just don't want, I want to wait a little bit longer, that this will encourage them to get vaccinated now when they see what it opens up for them. But it is the case that the virus will probably never completely disappear. It will probably always be around, just like flu and many other respiratory viruses are. And we're going to have to learn to live with it. So that's a quick overview of what's happened in the last year with regards to the virus.